Good evening. Welcome to Live United. Live United, great processes and programs and initiatives going on across the Monadnock region that make a difference in the lives of our citizens. And today I am joined by Chris McLaughlin. Chris is the Cheshire County Attorney, and he is joining us to talk a little bit about the Cheshire County Drug Court Program. Also going to talk about some of the issues we're encountering within the Monadnock region in terms of the well-being of our citizens. So welcome.
Thank you.
Thanks for being here.
Pleasure to be here.
So I was talking with you off air a little bit about the drug court program, and give us a little history on that, because I'm sure that many of our viewers still may not even be aware that this exists here in the Monadnock region.
Sure. The program's been up and running about 2 years now. It started when the county received 2 federal grants, a SAMHSA grant and a Department of Justice grant of about $1.3 million that allowed us to get the program up and running. Essentially what it is a program that deals with high risk, high need people involved in the court system. It's in particular in the Superior Court. You have to essentially be charged with a felony and have a fairly significant criminal history, and then you have to also have a substance use disorder that would place you in a high risk, high need category. If you meet those criteria, and you're either not looking at a crime of violence or have a crime of violence conviction in your past, then you most likely would be eligible to apply for the program. Once you make the initial application, if you're determined to be legally eligible, then a couple of different evaluations take place to make sure that you are high risk, high need.
So let's define high risk, high need a little bit here. What
Sure.
would make a person high risk?
High risk is somebody who, without the intervention of the program or the treatment involved, would be likely to go out and continue to use and create and commit new crimes. So that's the risk component. And high need essentially is the level of their addiction and substance use disorder.
Okay. And is need also defined by the support system that they may have around them as well?
No, it's more focused on essentially their how long they've been addicted, what they're addicted to, things of that nature.
Okay. And so I'm sure people are saying, so, you know, what's the typical person that you see coming into the drug court program? And I'm sure there's not a typical, because I know you have male, female, and you have a variety of ages coming through that program.
Yeah, I mean, we have, I think it's probably 35% female right now and 65% male. They are there, obviously, because they've been charged with a felony. The type of crime differs. Some are charged with possession of, drugs. Others are charged with theft-related crimes, some with burglaries, and they come from all different types of backgrounds. Their ages, we have quite a few young people in the program. I'd say between 19 and 25, but we do have some older people in the program also.
And if I remember correctly, because I attended one of the graduations of some of the folks coming out of the drug court program who successfully completed that, right. Some of them are parents.
Oh yes, absolutely. Yeah, a lot of them are parents. In fact, there have been 4 babies born while the person was in drug court. There are a lot of the participants have children, and that's a big component of the recovery is trying to get sober so that they can be there for their children.
So is this a choice program for the people that end up being referred to this? You can have the need, the risk, but do you have to want to do this?
No, actually, the national gurus of that started drug courts 20, 25 years ago say that motivation at the beginning is not a requirement. People come to it for different reasons. Some people come to it because it's either I do this program or I go to the state prison, or I do this program and I spend a year in the House of Corrections. So they don't have to be motivated when they first get into the program, but at some point along the way, they're going to either catch on and determine what they have to do, or they're eventually going to be terminated from the program. So at the beginning, motivation is not required.
That's interesting. It's
Right.
a really interesting concept when you think about that, because lots of times people, because it's a disease, you may not be ready to deal with that disease of
Absolutely.
substance abuse, and but you're getting into a system that's going to support some change, some lifestyle change, some behavior change, and ultimately your thinking.
Right. I mean, you hear about interventions all the time. People, engage in interventions with family members or whatever. Well, this is like a judicial intervention,
Yeah.
essentially. You're involved in the criminal justice system, and they're intervening to basically say, this is an option if you want to pursue it.
And what's the, I don't know if I want to use the term success, but really, what's the growth that occurs for a person, and what do they really accomplish by going through this?
I think they learn a lot of different things about themselves. They learn that there are resources out there for them. I mean, the program's pretty intensive. Some people work, some don't. But in addition to work, they're going to intensive outpatient programming, self-help groups, whether it be NA or A or some secular version. They're subjected to at least three random drug screens a week. They come to court and meet with a judge. At the beginning of the program, it's every week, but then it goes to bi-weekly if they're doing well. So in addition, there's other types there's job, we vocational training and things like that we can guide them and give them directions in that sense. So it teaches them essentially to first of all to develop a schedule. They have to keep logs. They have to account for every hour of their week. And a lot of times they've never developed those skills. So, you'll find people early on in the program, don't realize that they have to write down everything that they're doing. They have to keep appointments. So it's kind of developing those skills in addition to the counseling and trying to develop different skills for combating their addiction.
So how many people at a time are generally involved with the drug court?
Right now we have 32 active participants. Wow. Yeah, so we're getting close to our max. I'd say 30 to 35 is kind of the optimal number. We've had 6 graduates. 10 people have been terminated from the program. And the program it's a phase program, so you have 3 different phases. Currently, I think we have 11 people in phase 1. Actually, we have 20 in phase 1 and 11 in phase 2, and then 1 in phase 3. So, and the phases can vary. They're a minimum of 4 months, but depending on how you're doing, it could take longer. So you can go from phase 1 to phase 2, and then begin phase 2 and have some setbacks and a number of relapses, and then get bumped back to phase 1. So the program, I mean, ideally, if you went through it and did everything fine and didn't have any issues, which is rare, then you could get through it in a year, but it can go on much longer than that.
So what is the average length that most of the folks that are completing the program?
I'd say the first few graduates we had went through pretty quickly, a little over a year, and then since then it's been longer. And I feel like we have quite a few in the program right now that are going to bump up against the 2-year time frame instead of the 1-year time frame.
Again, we have to remember that this is a disease, and in a way, it's really nice that people can move through phases, come up against those obstacles in their life, because that's real life.
Right.
for people. And just like with any disease, you're going to potentially have a relapse. You have to understand how to work through that and get back on track in your life. And really, this is providing a supportive mechanism for people to have that opportunity.
Right. And it's definitely an ongoing process, because what we've been told by the national experts and what we're seeing firsthand is that people, as you progress and get farther along in the phases, the supervision ratchets down. And that's when you'll often see a relapse, because that support system is kind of backing off, and we're trying to get them to to be more self-sufficient. And that's oftentimes when you'll see a relapse. So we have to keep that in mind as far as continuing the random drug testing and continuing the other supervision and counseling aspects of it.
You know, one of the really unique pieces of the whole program, and I know we've benefited at the United Way and many of our partners have, is that part of what they're learning is how to get back to a community that they may have taken from. And so they get very involved in volunteer
Right.
work out there.
Right.
And I know we've been recipients of that, and boy, it's they redid the whole interior of the United
Right.
Way for us.
Yeah, I mean, drug court participants have donated thousands and thousands of hours of community service as part of the program.
Mm-hmm.
Whether it be, initially we had it as a kind of a component of their weekly requirements, but now we've kind of just used it more as a sanction. Like if somebody misses a UA or a urinalysis test, they'll have to go and do 5 hours of community service. So it definitely is, I think, an important part of the program.
And I think, again, them learning that, they may have taken because they're involved in the system somehow, and that's how they get to drug court. So really understanding, I've taken out of my community, now I have an opportunity maybe to do something good and turn things around.
Right. Absolutely.
And I think it's also important in terms of perception that may exist out there, because I think oftentimes people look at that record and they have a hard time seeing beyond that person who's using the substance or that person with the existing
Right.
record.
Right, and we've had participants who have done community service for different organizations that have actually wound up being employed by those organizations also at some point down the road.
Which is just great, and again, it's one of the unique pieces, I think, of the program that's just of tremendous value to the community.
Yeah.
I'm sure people are curious what you're seeing in terms of the types of substances that you're seeing the percentage of people coming in with the felony-related issues attached to. And I know there's a lot of discussion about heroin and fentanyl right now,
Right.
both across New Hampshire and across the nation. This is an actual epidemic across the whole country right now.
Right.
There isn't a single county or community that is immune from this.
No, I mean, it's amazing. Most of the participants in drug court have their primary addiction is opiates. They could be, polysubstance abuse, but it's mostly opiates. And in New Hampshire, fentanyl has really become a huge issue. The overdose deaths have gone up and up between 2010 and 2013. Overdose deaths by drug-related overdose deaths hovered around 175 to 200 a year. 2014, it went up to 325, and this year, 2015, we're on pace to exceed that and possibly even get to 400. And I think the primary cause of that is fentanyl, because it's either being sold they'll take a little fentanyl and mix it with glucose and sell it as fentanyl, or it's being mixed with a heroin. And it's 30 to 40 times more potent than heroin, so that's why you're seeing so many deaths related to the consumption of the fentanyl.
And I know that, in the sort of the whole southwestern corner here, Vermont, New Hampshire, Western Mass, what we're seeing is that combination piece, and,
Right.
and it's of huge, huge concern right now for the reasons you just mentioned, that it's 30, 40% more potent.
Right.
But, the mix of those two is significant. And we've had deaths here in the Monadnock region of our very own citizens. You and I were talking offline, the typical profile of a person, and there is no typical profile. It's, I was sharing with you that it could be the person sitting next to you,
Right.
In your place of work even,
Right.
or perhaps your next door neighbor.
Yeah, no, absolutely. I mean, I think it cuts across all socioeconomic strata. That I've heard the figure that 40% of people that eventually start using heroin started with a legitimate prescription for a painkiller. They had an injury, obtained a legitimate prescription for the pain, and then it just kind of snowballed from there. They became addicted to it, started buying pills on the street, and that got too expensive because of the prescription monitoring program. Pills on the street aren't as available, so then they switched to heroin. So, it cuts across all types of people.
In all ages.
Right.
I think we become most alarmed when we see that young person because we care about our kids in particular. But the reality is this cuts across all age groups now.
Yeah.
We're even
Absolutely.
seeing it, into the 40s, 50s, 60s. And, partially because people don't have access to perhaps something they've been on prescribed.
Right.
And that's become more difficult. What else so we have this great drug court program that deals with a very specific population that's committed felony, that's high risk,
Right.
high need,
Right.
been identified, is receiving that support. What else do you see us doing here in the Monadnock region to really have some impact on these issues, whether it's fentanyl and heroin or any of the drugs of choice people make out there?
Well, I think, and this is no secret, that the lack of treatment resources across the state is just unbelievable, and that one of the key components of changing that, I think, will be the Medicaid expansion and that going through, because a provider's not going to want to come in and set up shop unless they know that somebody's going to be able to pay for the services. And some people with private insurance, have significant substance abuse histories, but you're going to find that the vast majority of people are those people that are going to be on Medicaid. So, and once that is approved and there's a guarantee that that is going to stay in place, and I think you'll find more treatment providers coming in and setting up shop, whether it's residential treatment, whether it's intensive outpatient treatment, whether it's medically assisted treatment. I mean, that's a huge component of particularly opiate addiction, is having the ability to treat it and control someone's urges through legitimate medication, whether it be methadone, Suboxone, or they have the best case scenario from my perspective, because it's a non-narcotic, is Vivitrol, which is a monthly shot that they provide. So those resources are lacking in the community also. So I mean, you really need to build that supply of resources to address what I call the demand end. As a prosecutor, I mean, my office is kind of in a unique situation in that we can deal with both the supply end and the demand end. And what I mean by that, the supply end is your dealers, and for those people who are truly, dealing and making money and making a living out of it, versus, people that are really just addicts and buying some and then giving it to their friends or so that they can keep using. The true dealers would essentially, we can deal with them by giving them lengthy prison sentences. On the demand side, those people who have committed crimes because of their addictions or related to their addictions, we can try to craft sentences that hold them accountable, make victims whole, but also get them the treatment that they might need or probably do need, so that they don't reoffend.
You know, the Monadnock region and the Cheshire House of Corrections in
Right.
particular have a fairly unique system of support and care for those who may come through the criminal or the justice system. You know, we've got quite a network of counselors providing support. Even the design of that whole building, if people have never been out there,
Oh, yeah.
it's very uniquely designed. It's a pilot example for many other locations now to really think about how they set up their systems differently. So we have this support network for folks. What are your thoughts on what do we need to be doing to prevent them from ever getting to that place of you seeing them in the courtroom, them ending up in drug court, or ending up in our justice system?
I mean, that's a huge question. I think it would involve many things, obviously, education from a young age. It would involve trying to reduce the flow of the product, whether it be through, reducing the number of prescriptions or making sure that those legitimate prescriptions are not making their way to the streets. And then obviously going after the dealers of the drugs. But, I think it involves, many different prongs. I mean, so that's one way. And then there's the treatment for those people who do become addicted. There's the treatment focus. But, like you were saying, the jail, unfortunately, our jail is probably the biggest mental health provider and substance abuse provider in the county at various times. If we can get to the point where, they're not filling that role, then we're on our way. But
It is a significant challenge. I think one of the exciting pieces, though, and that was part of the reason I love the whole Monadnock region, is that people think about these things and they're willing to be doers and really see how we can change some of these situations. Mindy and I were on the show earlier. We're meeting later today, and we're really talking about how do you look at homelessness really differently than we currently do, and how can we be more effective in addressing this issue. I think the same applies when we look at drugs, the mental health issues. We have to come together as a community, and we have to stop judging, and we need to start doing and really thinking innovatively, supporting things like the drug court program, really thinking about our correctional facility and how do we, perhaps be housing people there that are not experiencing a disease, mental health issues and substance abuse issues. I'm sure a lot of people are probably feeling a little alarmed to think that our biggest mental health and substance abuse facility is our correctional system.
Right.
And is that where people belong? In the correctional system. And right now, part of what we hear from parents, for example, on the planning that's going on around mental health and the system of care for mental health here in the Monadnock region, is that you can't get the help you need until you get into the correctional system, until you get into the justice system. And then you lose your ability to have any control over that.
Right.
Drug court is amazing because it's trying to give people back some of that, to empower them to change their lives. So it's really, I think there's mental health courts now, too, from what I understand. Is that true?
Oh, yeah. I mean, Cheshire County at the circuit court level, which is the misdemeanor court, has had a mental health court, and it was originally called Mental Health Court Alternative Sentencing Program.
Right.
It's now called Behavioral Health Court. That's been around for, I want to say, over 20 years. I mean, it's been around for a long time, probably 20, 25 years. So it's a different type of program, and that oftentimes it involves somebody, when somebody with a mental health problem gets involved in the criminal justice system, oftentimes it is a kind of a nuisance type of crime, and so they get into the system, and the mental health court program stabilizes them, gets them reconnected with Monadnock Family Services or whoever was providing services for them, stabilizes them, and then gets them out. It's a much shorter term program. It lasts, probably 90 to 120 days for that process to take place. But it's true. I mean, oftentimes you will find people that are in jail because our mental health system it doesn't have the resources to deal with them in the community necessarily.
And so the same holds true for the substance abuse. So we have substance abuse, we have mental health issues.
And oftentimes they go together. You'll have somebody with a substance abuse, disorder as well as having mental health disorders. I mean, I think, I'd say probably 70 to 80% of the people at the House of Corrections fit that description.
Now, are you seeing more veterans at all coming in to the system at all related to these mental health, substance abuse issues?
I haven't seen a lot. I mean, I've met with the veterans outreach people, and I know across the state it's certainly the case. I think in the Nashua, Manchester areas, that is certainly the case. Nashua has a veterans, kind of a veterans, not a veterans court, but a veterans track where they have weekly court sessions focused on veterans. But in Cheshire County, I haven't seen. I am obviously over the years I've had cases when I was a public defender where I represented veterans, and as a prosecutor have been involved in prosecuting veterans. But you don't see a lot of them, and my guess is that it's because we're not close to a VA. I mean, Manchester and Nashua area, you're fairly close to a VA. The Upper Valley, you're close to a VA. So. That's just my guess.
And it's interesting, I was sharing on one of the other shows that I had just attended a military culture training, and part of what they talked about is that it's so hidden that it's oftentimes there's issues out there, but we're not seeing them because nobody asks. And so New Hampshire is actually piloting a whole program to change the conversation for military families, whether they're active or inactive military members. But, and to change the whole culture around particularly substance abuse and mental health, and being willing to disclose that information and get the help that you need. Yeah. And I think we're just on the cusp of that. I know ServiceLink locally is really taking on that initiative to assist our vets here. Right. So, again, a great example of maybe how we can get to people before they end up in the courtroom.
Right.
And really that's what we want to see ultimately as a culture. Working with young children. We have the Impact Monadnock initiative going on, really looking at early childhood and how do we support and build healthy children for the future. Right.
No, absolutely. I mean, I tell people I kind of deal with the downstream effect of what happens. And, if whatever that can be done upstream, Head Start programs, just teaching people healthier lifestyles, which is going to translate to people feeling better about themselves and not want to use substances, fighting poverty, having, so any of those things that can be done are, I think, going to change what comes downstream.
One of the things I've thought a lot about, and I'm curious your perspective on this, is the pop-up of these urgent care facilities, where you really have no connection to your physician. And, you're kind of going in and out and seeing different people. And whether that could ultimately work against us somehow. Because, I remember growing up, my doctor I had until he retired, right. And I was in my 30s by the time he retired. I was actually hoping that he'd deliver my daughter, but he retired before that. But, boy, he knew everything about me.
Oh,
He
yeah,
knew my
I mean,
family, he knew what sports I played, he knew everything.
absolutely. Yeah, I mean, when I was growing up, I had a, pediatrician that actually made house calls, which might be telling
Mine
you
did
how,
too.
might be telling you how old I am, but,
Yeah.
it's true. There must be a business model for what they're
Yeah.
doing, because they're popping up all over. I mean, what does Keene have, 3 of them?
Three, and
Three.
then we've got the Be Well Clinic now
Right,
too.
and then across the river in Brattleboro, there was one right at the roundabout. So they wouldn't be doing it if it wasn't going to be profitable,
Yeah.
But again, are they developing relationships, long-term relationships with parents,
Right.
with patients? I probably not. I guess you could look at them as being service providers, but
Yeah, and I think about that, and I think how important the relationship becomes, and I think about things like drug court, because that is a key component of what goes on there. You're really developing relationships amongst several staff members that really support individuals. You bring the family in when appropriate as part of that support system. So, it's so important to have those kinds of relationships, and if we're not building them in. So I've been kind of playing with this one, thinking we probably need to think about and I think it's the medical system as whole. I don't think it's just the urgent care facilities, because I think the 15-minute window that you get with your doctor now probably doesn't allow them to get to know you the way they used to. And I know I always look for a physician who knows me and knows the things I care about in terms of my own well-being.
right.
So, but something I think for us to think about as a community as we move forward. Any other issues, thoughts, things you want the community to be aware of in terms of what you're seeing out there?
I mean, housing's a big issue. You just had Mindy in here talking about homelessness. I mean, for the drug court population, that is always a struggle for many of the participants. Sometimes, the shelters, as much as they try to keep them as sober environments, that doesn't happen all the time. So housing's a big one. Finding a clean and sober place to live for many of the participants is a big issue. What can be done to resolve that? I mean, it's going to take some money, so to build, building more low-income housing, affordable, housing. I think is a big issue in the community.
It's interesting because part of what Mindy and I, and as we convene people, and I'm sure we'll be inviting you to that convening, I don't know if it's just low-income housing. I think it's affordable housing. We have a whole, again, when you think about the substance abuse, it crosses over all these socioeconomic classes.
Right.
We're seeing that more and more with a variety of populations out there in terms of them being homeless or not able to afford a roof over their heads anymore.
Right.
And it's not that they're not working. It's not that they're living off the system. It's that they just can't afford to make ends meet. And they have to give up somewhere, whether it's transportation, and then they can't get to work,
Right.
Or their home, or their food. I sit in a unique position because I'm at the United Way, where we support a lot of these agency partners out there doing great work. But one of the things that we're seeing more and more is, and our recent data that we collected, is, for example, people going to the community kitchen. When they get food from the community kitchen, it allows them to shift the resources over into keeping a roof over their head or transportation. And we have all the data that they've been tracking on how people reutilize that. So it's not that they're necessarily covering everything, but it allows them to fulfill their basic needs by perhaps having that housing. And I'm sure it's the same for folks coming out of the drug court.
Right.
If the system supports them over here, there is the need for other pieces to be in place to make the whole picture work. The Monadnock region I just did a Your Money, Your Goals training, financial empowerment training, and part of what we talked about is that housing here in this region is above what is the national average that you're expected to put into rent
A
or mortgage.
percentage
Percentage,
of your income.
Yeah.
Yeah, I believe it.
So it's quite a bit above where you would expect it to be, and that gets fascinating as you look at the towns across the region and what the cost of housing is in these towns, and what it has done is created a more transient population for us too.
Yeah, I mean, and the other thing is that you couple the high housing costs with the fact that you basically have to have, there's no mass transportation.
Right.
I mean, unless you have a job in Keene, live in Keene, you have to have a car and all the expenses associated with that. It's just, between the gas, insurance, and everything else, it's just.
Yeah. And we just had someone that we were working with, and he said, I can't afford to live in Keene. So I have to live outside of Keene if I'm going to have a place to live.
Which means you have to have a car.
But then you have to have a car,
Right.
and then he's challenged with having a car to get to work. So it's a delicate balance now for many, many people. Mindy was talking about in the previous show that she wonders how many people are one paycheck away from being where she sees people in her service. And, that a lot of people that she sees coming in, they were people that were doing okay, but then something happens in their life, whether it's a health issue, they may have lost a job, it could be any number of things, and that balance is all thrown off.
Right.
And we're seeing that more with the elderly now here in the region. So, what I hope for is that we can really think about what are some of those upstream things that we can be doing so that they don't see you, Chris,
Right,
downstream.
exactly. Absolutely.
We really want to get them away from the floating downstream here.
Right.
Yeah.
Right, divert them out of the river before they hit the waterfall.
Absolutely.
Right? Yes.
I've heard Jeff Miller, talk about, before people go off the cliff and the ambulance is picking them up, why don't we do something, put up a guardrail at the top here
Right,
so people don't
exactly.
go off.
Yeah,
So,
absolutely.
it'd be great if we could see that. But, drug court is an amazing solution for many people out there. And, we've had one of the young people who actually completed that program on the show before and, made a difference in their life.
Oh, absolutely. And, and I say even the participants who are terminated, that if they've been in there for a while, they've learned, so they're terminated, they'll go to jail, they'll get back out. They've learned some skills during the time period of months or even over months. There's, people who are in it over a year and still get terminated. They've developed some skills, and so, they can fall back on them if they choose to when they get out, and hopefully, be better for having gone through the experience, even if they haven't technically graduated. So, I mean,
And that's a really important message. I always used to, I can remember saying to my mom and dad one time, I said, you instilled the values in me, the skills, the behavior, the values. And even though I might not have chosen to use them all the time, they were there.
Right.
And when I was ready to use them, I knew how to use them. And I think about that lots of times as we go into parenthood in particular, that, we go through that growing up period, that life experience period, and we may not make the best choices all the time, but if we know how we can do it differently, we can change that in the future.
Right. Yeah, I mean, I think it's important to give the people the opportunity to do that, because, I mean, my philosophy is that, unless it's a heinous crime, the people are 95% of the people are coming back into the community at some point. Mm-hmm. They could do their time, but when they get out, they're coming back into the community. So if you can give them some skills that will make them, better off when they come into the community, that it's worth trying that.
Is there anything that you feel like the drug court or the work that you're doing needs from the community?
Yeah, I mean, I would say a willingness to work with people with criminal histories, if they feel comfortable with it, particularly, employers, people that would often need, because a lot of the people, and a lot of the participants aren't highly skilled, so they'd be mostly in the construction trades or mechanical trades, and having to learn those trades would be great. I would love for somebody to be able to step forward and say, yeah, we'll hire some people and train them and give them skills so that they can earn a decent living once they learn and acquire the skills. So.
And if there was a business out there interested in doing that, would support be provided to them in how to be more supportive of the particular people that they may be employing? Because it requires a lot on the part of employers
Right.
to really understand the issues a person may be facing.
Right. Yeah, I mean, if someone's actually in drug court, you're not going to find a person who's being more highly supervised ever. I mean, what other job do you have an employee who's being drug screened 3 or 4 times a week,
Right.
Has to go to counseling, has to do all this other stuff. So if that person is going off the rails, we know it quickly. And so, from a risk perspective, that person is being supervised pretty intensely. So it's not really a high risk to the employer if they wanted to teach somebody some skills that they could use for a lifetime.
Yeah, but they can also become part of the support network. For
Oh,
that
absolutely. They
individual.
can. Yeah, they can.
And I think about the young people we've had come through, both males and females come through the United Way in volunteering, and we really made an effort to also support them in their path and their journey that they were taking through the drug court.
Right.
Because we felt like it was really part of what we could do in terms of supporting them, making them feel connected to the community, letting them know that there's people out there that do care and want to see them
Right.
healthy and well and out, being part of the community.
Yeah. No, the United Way was a great resource for a lot of particularly the earlier participants in the program.
Yeah, boy, we sure had a lot of them come through.
Yes.
And we're in the process of really working on other volunteer strategies right now. So I know that's something we'll be looking at again, is how do we engage them in being, having that sense of belonging with the community, that commitment to the community in some ways. And I think that was it's funny because that's one of the skills that I think we instilled in them, was the not just giving back to the community, but feeling like they belonged to the community and that they were really important to the community. And I think about some of them that chose to continue to be involved and reached out trying to understand all the different services out there and how they could support those services and things. So it's a great, there's mutual benefit
Absolutely.
to all of this. And it's really part of what this show is all about, is how do we live united? How do we create the best community to live in? Support people in their journey through life, and from whether it's from pre-birth all the way to their retirement.
Right.
And just living as well as possible. Before we leave, any last thoughts you want to share with the community?
I guess with regard to just to put it in perspective, with regard to the heroin and fentanyl problem, so generally New Hampshire has 20 to 25 homicides a year. They have generally, historically, 120 to 130 motor vehicle fatalities. And we're talking possibly having 400 drug-related overdose deaths this year. So that kind of gives some perspective about how if you think about the resources and energy devoted to those other types of deaths, then it gives some perspective as to how important, this issue is becoming.
So, audience, we want to let you know that you get involved in the drug court program. It's not something you can just call Chris and say,
No.
I need my child or my spouse in the drug court program. It does go through the justice system. It is felony related. But there is other supports out there. And although we are challenged here in New Hampshire in a very significant way with resources being provided to support treatment, intervention services, prevention for people, there are some things that are available. And, if you or someone you love is dealing with this issue, especially as it relates to heroin and fentanyl, we encourage you to reach out to your local providers here. If you really don't know where to go, you can contact ServiceLink here in the Monadnock region. You can also contact the United Way. We will try to direct you to the best services that may be available, recognizing that it may not be available immediately, but everyone will be doing the best they can do to support you. So also encourage you, Chris mentioned the self-help groups that are out there. And reach out to those self-help groups, Narcotics Anonymous, Alcoholics Anonymous. Again, you can contact the United Way. You can call 211 here in the state. If you can't remember anything else, just dial 211 and they will refer you to a local program, whether you're here in the Monadnock region or perhaps watching this over in the Nashua or another area in the state right now. Chris, I want to thank you for joining us and bringing this issue both to the attention of the Monadnock region, but also really helping with the solutions out there and being proactive about making sure we get help where people need it most. So thank you.
My pleasure.
And audience, I'd like to thank you for joining us, and I want to remind you to remember, please give, volunteer, and advocate. Live united.